I want you to think about something. Let's say after months and months, and maybe even years of living in discomfort and never-ending appointments with doctors and specialists, you're diagnosed with a terminally ill disease. Would you want the right to ask your doctor to end your suffering, or do you think that's too much to ask of someone? According to an online dictionary at merriam-webster.com, the definition of assisted suicide is suicide committed by someone with the assistance from another person, most likely a doctor or nurse. This is also known as physician-assisted death or death with dignity. Have you ever had a close friend or family member that had to live in extreme pain or discomfort in the last days, months, or maybe even years of their life? Given the choice, do you know enough about physician-assisted death to make an informed decision? First, I want you to understand that I'm not talking about euthanasia, which is illegal in all states. Dictionary.com defines euthanasia as the act of putting to death painlessly or allowing to die by withholding extreme medical measures a person or animal suffering from an incurable condition. This is also known as mercy killing. Some may remember the controversial case of Brittany Maynard. At age 29, she was diagnosed with terminal brain cancer and given a prognosis of only 6 months to live. At the time, her home state of California didn't have the current California End of Life Option Act, which was signed October the 5th, 2015, and went into effect June the 9th of 2016. You can find this information at californiadeathwithdignity.org. Because Brittany had an otherwise healthy and young body, she was likely to physically cling to life, even though the cancer continued to eat away at her mind. Because she didn't want her family to watch the suffering and mental decline, she chose to use the medical practice of aid in dying. Brittany and her family moved to Oregon and set up residency there. She spent her last days celebrating her husband's birthday, and with her loved ones surrounding her, she chose to pass away on November the 1st of 2014. On October 27th of 1997, Oregon became the very first state to enact the Death with Dignity Act, which allows terminally ill Oregonians to end their lives through voluntary self-administration of lethal medications. These are prescribed by a physician for that specific purpose. Oregon.gov states that in order to participate, a patient must be at least 18 years old, a resident of the state of Oregon, capable of making health care decisions about himself or herself, and be diagnosed with a terminal ill condition followed by death within 6 months. Once that criteria has been met, there are several other steps to be fulfilled before participation, including 2 oral requests by the patient to the physician, followed by a written request that has to be signed by 2 witnesses, confirmation of the diagnosis and prognosis, the determined ability to communicate and make decisions about one's health. There must be no impairment of psychiatric or psychological disorders such as depression. Physicians must inform the patient of alternatives such as comfort care, hospice care, and pain control. Physicians must also report all prescriptions for lethal medications to the Oregon Health Authority, and pharmacists must be informed of medications' ultimate use. Since Oregon Death with Dignity Act, 4 other states have legalized various death with dignity statutes. Vermont in 2003, California and Colorado in 2016, and Washington, D.C. in 2017. I hope I've answered any questions you might have about assisted suicide, and though I pray you're never in the situation to have to make this choice, you will at least be a little more informed on the process of physician-assisted suicide.